I'm Ryan Melchior. I'm an interventional cardiologist at VCS, and I have particular interest in complex coronary work and also peripheral vascular disease. One of the best parts about interventional cardiology and treating peripheral vascular disease is that there are procedures we can do that actually fix the problem. So medical management, of course, is always the most important thing to what we do, and preventative care, very important, but we also get the opportunity with interventional cardiology to really fix acute problems, to really have patients leave our office or leave our procedural area feeling much, much better. So the fact that we can actually get in there and really fix problems and really improve patients' quality of life is a really rewarding part of the job. The most common sign of peripheral arterial disease is claudication, and what that means is that patients get pain in their legs and especially in their calves. They'll get cramping pain or feel like their legs are really heavy. So that's the biggest sign. And then the other sign that's really important is what we see with what's called critical limb ischemia, and that's patients who get wounds or ulcers, and they often start as very small ulcers that patients kind of ignore for a while, but these wounds can really progress. And the issue is if you have blockages in the leg arteries and you're not getting enough blood flow down to those wounds, they have a very hard time healing. And this is what we see that leads down the roads to major infections and amputations. It's really important that you diagnose quickly and early that they have vascular disease, and then you go ahead and intervene and improve that blood flow, because that's really the only thing that will allow for wound healing and kind of limb salvage for these patients. So the major risk factors for peripheral vascular disease are the same things we see as the risk factors for heart disease. So high blood pressure, high cholesterol, diabetes, smoking, obesity, these are all the main risk factors that we see. Every year those numbers and the percentage of Americans with peripheral arterial disease is drastically increasing. And that's why we want to have this big push for this awareness, so that not only primary care doctors and cardiologists are aware, but really a push for patients to really kind of have this understanding of, hey, I have risk factors for this disease, and really pay attention to the symptoms, the signs that they could have peripheral vascular disease, because really early intervention is what really makes the difference for these patients. VCS has the full armament of testing where a patient can come in with very basic symptoms, and we can start with basic screening from ABIs to arterial duplex. We can then progress to CAT scans of the leg arteries if we need to, and then now with our OBL that we've built out, it really also allows us to then also treat a patient fully with very complex procedures, all kind of under one roof, so that we can take a patient who basically comes in and says they have these basic symptoms, and we can take care of them from start to finish, all through our offices and OBL. And that's really been the goal, is to have one comprehensive care facility where we can really take care of these patients with vascular disease.